I have here Radar Opus software with the new Synthesis Adonis.
Yeah.
And there's always a dilemma that on the one hand there are new directions and who use new remedies and who are quite progressive, but there are also directions who are more conservative. And in the Synthesis Adonis, on the one hand, Frederick Soyens has invested 10 years of time to add classical additions. There's still a lot of information in the old sources, good clinical additions, but there are also a lot of modern provings, etc. And to compensate this, to make it possible that both let's say schools can use the software, there's something called Repertory Views.
Yeah.
And you have been helpful to create a repertory view which we named after you. Here is a repertory view of Veneeth Sidharthan.
Yeah.
And can you tell me something about what this selection is based on? Because like in Kerala, in your what do you call that? Your province, or your state. Mm-hmm. How many remedies does the average homeopath use? And is that view aimed for these people?
Yeah, obviously, the repertory is a very great, invention by the Frederick Soyens. Kudos to him. In Kerala, when we come to Kerala, there are a lot of schools and a lot of methods they are doing and all. But the Hahnemanian method, I believe in Hahnemanian method. And in Kerala, when you check with the doctors, I would say there are a lot of homeopaths there who are working for the government. Mm-hmm. So we have a lot of government dispensaries there, and more than 100,000 people every day going to the government dispensaries, and more than that people are going to the private dispensaries also. So if you take the people, it's like maybe more than 80% of the people, they are maybe they are using only less than 100 remedies. Yeah. So there is no use of taking all these, the other ones, and mm-hmm. you have to see how much patients they are looking after. A government doctor in one dispensary, they are looking more than 150 patients a day. 150 patients a day. And in Kerala, the government allowed a dispensary only for the treating infertility. Last year, we got 430 newborn babies. Mm-hmm. They are only using this type of medicines there. Mm-hmm. And for cancer, only for the cancer, the government is provided a hospital only for the cancer. They are also doing like this. Mm-hmm. So it means we need to show the results. If you are getting results with these medicines, it's working. Look at the numbers, that's very important. Look at the numbers, that's very important. Even I'm a private doctor, I'm looking like maybe more than 60 people. I have results in cancers because that I am showing now. And not only that, what I am doing with the workshops or seminars, I am taking the patient live cases, I am showing the people what we'll do with the medicines. And the next time when I'm doing the workshop, the patients will come, they will explain, okay, I'm getting good vibes. And obviously I'm using all these classical remedies only. Maybe sometimes I in one case I told about Skukam Chukakwa. Yeah. I got that medicine when I took the case after being vaccination of the yellow fever. So I got cured. I got a cure from that. Yeah. But it doesn't mean that for everything you have to look after something which is extraterrestrial. The normal medicines will work.
So with, let's say, with 200 medicines, you do maybe 95% of the cases?
Why not? 95% of the cases.
And then only for those 5% you're going to exceptionally...
if it is not working.
If not working. Yeah. Okay. So
some people says that if in Europe it's difficult because the European people, the mental things are different, emotionally they are different, complex and all. But I'm giving medicines for the people in Europe also. In Spain we are doing live workshops. all the people are getting good results with the normal homeopathy, like the sulfur, the arsenicum album, the calcarea carbonicum, hyoscyamus. It's very, very nice cases I have there. So you can say anything. You can say any theories. You can say any air castles. You can think about anything. Nothing. You have to show the results. That's very important. You have to show the results in the front of people, right? That's how the homeopathy will grow. Otherwise, homeopathy is, how homeopathy degraded in Europe. It was found in Europe. It originated in Europe. It flourished in Europe. And now, what is the circumstances in Europe? What is the present scenario of homeopathy in Europe? Only because of the practitioners, only because they can't able to cope up. They are not into the basics. That's the problem. If they stick on the basics, they can cure the patient. That is what I am doing in Spain. That's what I am very confident that I can do that. If I can do that in Spain, I can do, because now the doctors in Spain, they are getting patients after the mouth publicity. The patients who got cured with homeopathy, they are giving the mouth publicity. Now the number of patients increased more than the doctors, because the patients are giving examples to them. Yeah, I got cured by this, and she brought her two sisters with her. The fibroid lady I was telling about, the uterine fibroid lady, two sisters came this time. So it depends only according to the results, not the theories. The theories won't help the system to grow up, only the results. So we have to focus on results. If you want to get the results, you must be focused on homeopathy, and the correct homeopathy by Hahnemann. That's what I'm always telling, individuality, not treat the disease, treat the patient. So you don't have to worry about the new diseases, new things, new names. Who put the new names? When Corona came, what was the symptoms? It was the symptoms of bryonia, Ristox, arsenicum album, maybe sometimes the China, maybe the camphor. It's not Corona. It's China or bryonia, like that. If you think like that, you can treat all the patients. Otherwise, you will be confused. You will be in a chaos. That's the thing.